Hello everyone. Today I'm going to talk about a very common treatment that is performed, that is platelet rich plasma versus the hair transplantation. So first of all, is there any comparison between these two treatments? I would definitely say no. There is no comparison at all. Why? Because PRP is something which is done during early stages of hair loss and hair thinning, and transplantation is the one mainly done when there is already a lot of thinning and baldness. So these two treatments vary a lot where on which stage of hair loss or hair thinning we are doing the procedure. So PRP is best when there is miniaturization that is happening. So miniaturization means that the hair thickness is falling gradually with time because the hair lifespan comes down. So with that the hair thickness also comes down. This leads to thinning and early hair loss that's seen commonly. PRP in the form of growth factors that is taken from the blood reverses this process. The hair is provided with good growth factors and this enhances the growth cycle of the hair and it increases the thickness and prevents hair loss. Whereas if the patient has no hair at all, that is there are no hair roots at all, PRP does not have any role to play. We'll take a scenario of a young age patient, say 18 to 20 years of age. So he comes to me saying that he's been using medicine since the past 6 months and is not very happy because he has a lot of thinned out areas. So for this patient, what treatment do I suggest? So I will definitely suggest him to go for a PRP rather than a transplantation. Young patients are generally very labile, so they are under a lot of social pressure, so they directly would say tell me that they directly would tell me to directly go for a transplantation. So that's the biggest mistake what any doctor can do on such a patient, because prediction of the level of hair loss in the future is very important for the success of any treatment. If we operate on an 18-year-old patient, he may be happy for the next 4 to 5 years, but in another 10 years or 20 years when his hair loss progresses to the next level, it will be very difficult for us to cover the area because we have already exhausted the donor area for the thinning areas. So it is always better to always start small, get your medical treatments right, get your PRPs, and if you're not able to take regular PRPs, opt for stem cells. These are very excellent treatments for long-term good results. And in the later stages, when you feel there is some kind of a bald patch or the area which is not improving at all, you opt for a small hair transplantation. That will give you a good overall wholesome results rather than directly going for one treatment just because some other person has gone through it or you have seen in a social media post. So always be careful and always approach the right people, right clinics to do this work for you, because this requires a lot of science, understanding of the artistry and also the emotional and the progress of the hair loss condition. Thank you so much.